Hello, it's Dr. Mariana Skander with Practically Pediatrics. It is back to school season, as you already know. And when schools opened up, all the viruses came back and infected our children. We are getting bombarded with cold and cough and fever and sore throat. And the big question is this COVID, or is it just one of the millions of other viruses that cause similar symptoms? So this is what we are seeing. Number one, a lot of these cough, colds, fever, sore throat are thankfully not coming up COVID positive, but the schools are still making you get a COVID test, rightfully so. You have to have a negative test to go back to school. You have to be 24 hours fever-free, and your symptoms have to be improved. However, not every cough is COVID. What we are seeing a lot of is something called Croup. So I'm going to tell you what Croup is really quick because there are very distinct features. So Croup is caused by a virus, and what it does, it will cause a very distinct cough. So the cough is described as a barking cough. It sounds like a barking dog or a barking seal. So this is what it sounds like. If you will do me the honors. Barking cough. It is very dry. It sounds like it's coming straight from the throat. There is no mucus involved. However, a little runny nose is associated with it, but it's not that wet, like rattly, deep lungy cough. It is it's a cough that's coming from the upper airway. So it's a lot more shallow and a lot more dry. So this virus can sometimes cause fever, especially in younger kids, and sometimes not if you're an older child. So they're going to start with this cough, and the cough is going to really increase at night just to drive you extra crazy. And then in the morning and during the day, your child would look a lot better. And then again at 2, 3 in the morning, this cough will resume, and your kid could be sometimes up all night coughing like that. So what do we worry about with Croup? Well, this virus is going to really affect, like I said, the upper airway. It's going to land about right here. And what happens is also in that area is your voice box, the larynx. So your child will often also have like a hoarse voice, like a very raspy voice, because this virus is causing a lot of swelling and inflammation and irritation in this upper airway. So the most important thing we want to do is protect the upper airway. Worst case scenario is that the airway is going to get so irritated it's going to start to swell closed. So the sign you're going to look for if your child has a croupy cough is what we call stridor. It's a type of noisy breathing. It is not wheezing. It is different from wheezing. Wheezing is a noise that you hear on the exhale, like this. Now with Croup, we get stridor. Stridor is a very harsh noise that you hear on the inhale. So we hear this really turbulent, harsh flow of air. Because the airway is so narrowed, you're going to get this really forceful pulling in of air. So that is stridor. If your child is having a croupy cough and they are breathing with that noise, you need to call your doctor right away. If it's in the middle of the night and your child looks very distressed and very uncomfortable, this is a time to go to the emergency room, because that airway is getting a little too swollen and your child is going to really fight hard to get air in. So what we do with stridor is, if you end up in the ER, they're going to give you a breathing treatment. It is not the same medication as that we give to asthmatics. It's something called racemic epinephrine. It's going to open up that airway very, very quickly. You're also going to get a dose of steroids, and it's usually a one-time dose. And those steroids are also going to help decrease that inflammatory response and open up that airway. If your child is otherwise okay, they are having the barky cough, You don't need to go to the emergency room, but you do need to call your pediatrician because your pediatrician can prescribe that oral steroid. We don't want to wait till the airway starts to get swollen up, ideally, and then start to backtrack and treat it that way. It is not going to cure your child of this virus. Again, there is no medication that kills viruses. Your child is still gonna have to go through it. It's gonna last about 7 to 10 days. But at least you're not gonna get that complication of a closed up airway. Other things you could do for croup is we just want to soothe the upper airway as much as possible. So that's when the humidifiers come out, a little vapor rub even, just to kind of keep everything very calm. Other thing we are seeing is RSV, which is another virus that we see a lot in the fall and the winter. RSV, it's a virus that causes wheezing, much like asthma symptoms. However, it does not necessarily mean your child is an asthmatic if they start wheezing, if they get RSV. However, some of those kids will go on to be asthmatics, some of them will not. My son, for example, unfortunately caught RSV when he was an infant, a few months of life. I thought he was going to end up like an asthmatic, like his mama, but he did not, so he's never wheezed again. However, we treat it the same way as asthma. So if your child is developing a cough and a cold and runny nose and even a little bit of fever, and you are hearing wheezing, again, that noisy breathing on the exhale, call your doctor right away and we will we'll do a trial of albuterol. Albuterol is basically a smooth muscle relaxer that you can inhale. It'll start to immediately open up those airways to give your child some relief. And again, you know, the chest rubs and the humidifiers really help get your child through those nights as well. Now, there's a million other viruses that we're seeing. We have hand, foot, mouth. Hand, foot, mouth is trickling in, guys. If your child has never had hand, foot, mouth, God bless. However, this is the time for a hand, foot, mouth virus. This virus, well, it's called hand, foot, mouth because it affects the hands, the feet, and the mouth. Your child will likely start off with throat pain and sometimes a fever, sometimes not. It's different from strep because if you look in your child's mouth and throat, you will actually see these little ulcers all the way in the back of the mouth. Sometimes it'll even be a little bit on the gums, or you might get some on the tongue. The hand and the foot part comes out when you get also these little spots on the palms of your hands and these little spots on the soles of your feet. Now that's the whole gambit. Some kids are just getting the fever and the throat pain. Again, this is one of these back to school viruses. Not much to do except time, Motrin or Tylenol for pain and fever, a lot of fluids, and then once those fevers break, and you are fever-free for 24 hours and you are feeling better, you can likely go back to school then. Now, I can go on and on and on and on about viruses and back to school season. However, I'm not gonna bore you with more. So if your kids are feeling a little crummy, call us first. We were not gonna bring everybody into the office, of course, or else I would be here, you know, working around the clock. There's only one of me, and there's a lot of you, and there's a lot of fevers. So you can call us and we will kind of walk you through symptoms and symptom control over the phone. However, if I'm hearing something that I really need to check in the office, we will definitely bring you in. Some of you I want to see, but I do need to see a negative COVID test first because safety is our first priority. You might be in the office with some other patients that are not vaccinated or too young to be vaccinated, so we definitely have to make sure you are negative for COVID, and then you can come on in and we can do the rest of the assessment that way. For information on where to get COVID testing for kids, you can call the office. There's a lot of urgent cares in the area that we can direct you. And if you are positive with COVID, we will walk you through the steps to take to clear you to return your kids back to school as well. All right. I hope that helped. I will see you soon. Thank you.